stages of seizures. So, does anyone know what a seizure is? Any ideas? Hands up. Yes?
When you can't move.
When you can't move. That can be part of it, but not necessarily, yes.
Is it like when the brain gets like loads of electric impulses, like an overload?
Yeah.
Is it?
Yeah, it's basically, I mean, we're no longer allowed to use brainstorm because that's effectively what an epileptic seizure is. Alright? Which is where all the neurons in your brain fire simultaneously at the same time. Now, thinking of this, there are 3 different types of seizure, okay, that can affect someone. The first is known as a focal seizure, okay? Now, a focal seizure involves a specific part of the brain. So, if it's not that bad a, seizure, you can have a mild seizure like that. You all see that? Right? Like that. That can be a seizure for someone. Believe it or not. Okay? That's known as a focal seizure, so that would do on one specific part of the brain. Moving on, we then have a generalised seizure. Now, anyone guess what this is? Yeah! Well done. The whole brain. So a general seizure will involve the entire brain. Yeah, it won't just involve one part of the brain. The third and final one is what they call a cascade or marching seizure. Now, this usually starts as a focal seizure, so it starts in one part of the brain. So it could be oral or, again, movement or anything like that, and then involves the entire brain. Okay, so that's why they call it a marching seizure or a cascade seizure. All right. Move on to the next slide. Now, febrile seizures, okay, they are not part of a recognised classification of seizure because they only appear in infants. So if they're under 5 years old, you might see a febrile seizure, and this is like for young babies and stuff like that. Usually they're more associated with things like chicken pox and high temperatures, all right? But they're not an official classification. So, you want to move on to the next slide? Types of seizure. Okay, so there are 7 different types. Okay, and we'll go through them so you can actually know what they are and what they do. So we've got absence, myoclonic, tonic, atonic, clonic, and tonic-clonic. Now, there's a couple of people, right, old school people, not looking at anyone in particular, apart from the person in the back of the room, right, who know petite mal and grand mal. Now, they're the 2 that a lot of people are familiar with, right? If you go into YouTube and you want to see what a seizure is, type in grand mal, it'll come up, all right? That's the chances. So, have a look at what these are. Right, absence seizure, they can be brief, so they normally last no longer than 15 seconds, and the person appears to zone out. So basically they look as if they're daydreaming. Right? But this is usually known in someone that knows they have epilepsy. For this type of seizure, there's nothing you can do about it. Alright, it just happens. Right? Myoclonic is the one I showed you earlier. Right? This is limb jerking. So it's, it can be known as a tic as well. And that's where your focal part of your brain isn't appeared with. Tonic seizures. Now, these can be a bit strange to witness. Okay? The person basically stops exactly what they're doing, where they are, and stops them dead for about 10, 20, maybe 30 seconds. Okay? And they usually present with like a whoop, like straight beforehand, so like they'll call out or something straight before, and then just freeze in whatever position they're in. Alright? So atonic are drop seizures. Now these are arguably the most dangerous seizures. Okay? There's not a lot you can do about them. all you can do is look after the aftermath. So if there is a serious injury due to an atonic seizure, all you can do is look after the patient afterwards. Alright? What a drop seizure is basically your legs go from underneath you. You actually drop. Yeah? And there's no warning for it. Absolutely zero warning. A lot of the people that you see that get diagnosed with atonic will usually wear scrum caps. So if you think about rugby, yeah, and you see those guys in the scrum, they've got those weird hats on, right? Someone who suffers from a lot of atonic seizures will usually be wearing one of them. Okay, this is basically to protect the head, alright? Because that is the most vital part of the body and it can happen. Okay? Your chronic seizures. Now, your chronic seizures are full body seizures, so this is where all your muscles move at the same time and they shake. But you don't lose consciousness, so you're still aware of everything that's going on around you. Yeah, so you can still interact with people, you can still hear what people are saying, you can still see what people are doing. Alright, you might not be able to respond to them, but you're still aware of it. Okay? The tonic-clonics are the typical ones that we think of when we think epilepsy. So we hear the word epilepsy, you see someone on the ground shaking, fitting, not responding or anything like that. Okay? For the purposes of this lesson, the tonic-clonic is the one that we will be looking at. Okay? Because these generally last the longest and they can last anywhere up to 30 minutes, if not longer. Alright? Ideally, they should be dealt with within 15 minutes. If they're not dealt with within 15 minutes, they can be deadly, but they can be fatal. Alright? Next slide. Right. We're going to look at triggers. So what causes a seizure? Okay? Now, we're going to use an acronym. We love acronyms, don't we? Right. We're going to use the acronym VISNIMS. Okay? And this enables you to know the different types of seizures and the different conditions that can cause seizures. So, V stands for vascular, which is anything to do with the veins and the head. Okay? So we're looking at stroke or a head injury. Right? So if someone hits the head really hard, they can black out and they can start to shake. Okay? That's a seizure, but it's not epilepsy related. Yeah? And that's been caused by something vascular.
Sorry.
Okay? Now, it's alright. Next slide. I stands for infection. Okay? There are certain infections like I said, mentioned before, chicken pox, especially if you're young. Meningitis for those who are older, and encephalitis. These are both, okay, infections. And encephalitis is an infection of the brain. Alright, so that can take over your motor functions and can cause